Hi, welcome to Highlights with Heather. So if you have change in your pocket, this will make it very, very simple. We also have a product size guide on our website that you can check it out. All right, so we're gonna throw it up on the screen so you can see as I'm talking. So when you use a cleanser, a lot of people think more is better. Actually, when you're using the right products, less is more. So when you're using a cleanser, you really only need about a penny size. For an exfoliator, which you should always use after your cleanser, a dime size, so a tiny little amount. When you're using a retinol or a serum, you want to just use a dime size. You don't need a whole lot. A little goes a long way with these products. Eye cream or eye serums, less than the size of a dime. You do not need a whole lot, and you just want to pat it around your eye to make sure that it does not go into the actual eye itself. Any type of anti-aging product, a penny size is more than enough. So for a moisturizer, you only need the size of a nickel, and that'll do your whole face plus down the neck area. For a neck cream, again, the same thing. You can also, if you're using a separate neck cream, you can just use the size of a nickel. If you're putting on a mask, you'll want to use the size of a quarter. Make sure that you're covering the whole area of the face, including feathering it down the neck area. Hand cream, you only need a little bit, just the size of a penny. Hand cream, again, it goes a long way and you don't need to overuse it. And then last but not least, the sunscreen. If you're using the sunscreen on your face, it would be the size of a nickel. So hopefully this helps so that you don't overuse your products and you make sure that you're getting what you need. We get asked this question a lot, and the biggest difference is that dry skin is actually a skin type. You know, your skin's either normal, it's dry, it's oily, whereas dehydration is a skin condition, which can change throughout the times of the year with different medications. How to tell the difference? It's a little bit difficult. I mean, they do present pretty much the same. Your skin gets a little bit dry, flaky, looks dull. So two biggest things, if you do have dry skin as a skin type and your skin's always dry, you want to make sure that you keep it moisturized. Always, always, always use a good moisturizer in the morning and the evening, and also keep your skin hydrated. Drink lots of fluid, lots of water. Same thing for dehydration. If you start to notice that your skin is flaking a little bit more and it's getting a little bit drier during the winter months where the heat's on, your skin gets drier, you want to definitely drink a lot more water, stay hydrated, and also use a really good moisturizer. And a lot of people don't know the difference between this. We're going to show you some photos so that you can take a look at the difference. So acne is typically caused by a bacterial infection or bacteria. Hormones can cause acne. You'll notice it as like a red, blistery pimple that can sometimes have pus, whereas amelia, it looks like it's a whitehead on your face and you want to pick it and poke it and pick it and poke it and nothing ever comes out. The difference is that that's not caused by bacteria. That is caused by a buildup of dead skin cells and keratin, which is like a protein that's in the skin that just gets built up. So for the amelia, what you want to do is definitely keep your skin exfoliated. You need to make sure that you have a great exfoliator that you use on a regular basis. Keep those dead skin cells exfoliated and off so that you don't get that. And if you do have amelia, don't poke at it or pick it. Come in and see a professional and we will extract it out and help to keep that pore clean and open. So I'm sure you've heard liver spots, sunspots, brown spots, and what's the difference between them? Also, freckles. I mean, do I have freckles? Do I have sunspots? What is it? Well, it's all the same thing. Sunspots, liver spots, sun damage, pigmentation, it's all the same. There is no difference. And freckles, a lot of people think they're born with freckles, but nobody's born with freckles. Everybody has pure, unpigmented skin when they're born. It's due to sun exposure, and it's also due to hereditary that you could develop freckles and pigmentation. So what you always want to do, regardless of what you call it, a liver spot, a sunspot, a brown spot, or freckles, you want to make sure that you keep your skin safe by wearing a sunscreen and staying out of the sun as much as possible during the hours of 10 and 2. That's when the sun's most harmful and does the most damage. So whatever you call it, they're all due from sun damage, so you want to make sure that you protect your skin and wear sunscreen all the time.